it's an elective procedure or an emergency procedure. Of course, if there's an elective procedure such as extracting a tooth or doing a spay or a neuter, that's going to be preventative health for longevity and health for your dog. If it's an emergency procedure or a mass removal, that can certainly be helpful too, life-saving even. There are some surgeries that require a specialist, but we do most surgeries here. A lot of times with orthopedic surgeries, we will refer out to a specialist. So we are considered veterinarians, and we do internal medicine, dentistry, surgery, cardiology, and those types of things on a general basis, kind of like your general practitioner. But there are board certified surgeons, just like you would have a board certified surgeon in the human field that would be doing your surgery. Your doctor refers you to a certain specialty surgeon. So elective is one that you elect to do. There's no time constraints to it other than the recommendations of when to, say, spay, neuter, mass removal, or dental cleaning and extractions. Those types of things are more elective unless they're associated with illness. If there's a dental abscess, or if there is a tumor that needs to be removed because of potential of cancer, if there's a bleeding splenic tumor inside the belly that's causing a life-threatening situation, that's more urgent. Anytime that we're going to do a procedure, we want to know your pet. We want to talk to you about it. We want to answer any questions that you have. We want to lay hands on your pet, making sure that we've done a full exam and identify any potential issues that may cause them to be more at-risk, an at-risk patient. We also want to go over any medications, any post-operative care that they need, as well as giving you kind of a time frame and expectation of cost and expectation of recurrence or recovery. When we have you come in for surgery, we will ask you to fast them from the night before. Usually after midnight, no food, water is fine. And then when they come in, they're given a small, light sedation, and then we will then put an IV catheter in, take any blood samples that we need to do to check to make sure their liver and kidneys are okay, to process the anesthesia. And then depending on where it is, generally speaking, if it's a spay or neuter or abdominal surgery, we'll shave the area. We'll surgically prep and clean that, and then we'll set them up in surgery, the surgery suite. When you do go under anesthesia, they're just like if you went to a hospital, there always is an inherent risk. Well, those risks are low, but they're still present. The unexpected can happen. But we do what we can to make sure that their liver and kidneys are okay, make sure their heart's okay, make sure they're not ill and too malnourished to go under for a procedure, so that they weren't able to heal very well post-operatively. So we just want to make sure that you're aware of the potential risks involved, as well as allow us to do the pre-anesthetic testing to minimize those risks. For most elective procedures, they go home the same day. For urgent procedures, it kind of depends on how the dog responds and their pain level. We try to make sure that they're comfortable and that everything's working the way it's supposed to, and that they're going to be well cared. They're going to be well enough to be cared for at home and not at an in-hospital environment. So they'll probably be sleepy. We do ask that you only feed half of their normal meal after a procedure like that. They'll probably be happy to see you, but exhausted from the whole ordeal being in the hospital, so they'll be sleepy for a little bit. But generally, if it's a spay or a neuter or a dental procedure, they're back to themselves the next day. Swelling, pain, or discharge, redness at the incision site. If they are not responsive, not wanting to eat or drink, overly depressed or tired, those types of things are a concern. For small dogs and cats, we will recommend that after their vaccine series and before their first heat cycle, we want to spay and neuter. Of course, puberty hits around 5 or 6 months for males or in dogs and cats, so we want to do that before they hit puberty. In older male dogs, or in male dogs that are larger, we do like to postpone that to a little bit later, 10 months, even 12 months before we neuter. However, if there's a large breed female dog, we want to talk to you about that before we schedule that. Generally speaking, it's better for them, decreases their chances of mammary cancer if we get to them, if we spay them before their first heat cycle, which is around 6 months. So that's still our recommendation.